Dear Ms. Kreisa, dear Andreas, dear guests and colleagues, it is a real honor to be able to share our vision and our experience so far with the Falsified Medicine Directive. This project, I think, is very much a believer's project. So, because it is a non-profit organization, it starts with very small resources. So I would like to start in the beginning with the question why. What it is about first patient safety, second about regulatory compliance, which is another benefit. Also another benefit is securing the supply chain, and last but not least is the value of standardization. So all these four benefits are there in this project, in the directive. Of course, the biggest ultimate challenge and gain is the patient safety. So in this sea of falsified products, there are some figures, some known facts, which are really very, very scary. In some countries, falsified products could be as much as 30% of sales of medicines. Internet sales, even though they are very much regulated, are very difficult to be controlled, so their falsified products could be about 50%. And even in some advanced countries, like in Europe, it was thought that it is about 1% to 2% the falsified products. But recent report from the Intellectual Property Organization shows about 4.5% falsified products in Europe. So the problem is big. Can you tell the difference? Which is the authentic, which is the counterfeit tablet, capsule? It cannot be told. And this is the biggest issue, that the patient, even when he has the product in the hands, cannot say what is, who is the falsified, which is the falsified, which is the genuine one. So here the facts are just for comparison. I took the first figure from one of the GS1 presentations. So Interpol data is 1 million people die each year from falsified products. So probably you know this from other meetings, but the next comparison figures, just to know the scale of the problem, is that HIV/AIDS mortality is about 1 million, and something which we know very popular, these are the death cases of traffic incidents. So these are comparable figures. But for falsified products, nobody is talking so much. So this is also part of the initiative to make the problem, the public more aware about the problem. For the falsifiers, this is very easy gain because the profits are huge. They don't invest in GMP. They don't invest in quality systems. They invest sometimes in packaging facilities to have the products very much like the originals. And the profit is 500 times bigger than the investments. And the penalties, the sanctions, are very small. So having in mind this, in many countries, this is recent gap of serialization of pharmaceuticals. In many countries started such initiative how to track and trace medicine products and how to be able to prevent the falsified products. I will not talk about these principles because they were mentioned very well by Dirk, by Andreas before me. So I'll focus more on how we implement this vision and these main principles in Bulgaria, in my country. This is the model. You saw it in different pictures. The key difference here, probably it is not difference, but this is just something which we decided we would like to have. Even though the system is end-to-end, we would like to implement verification on the entry of the pharmacy. which of course should happen together with our authorities, because this has several benefits. First, the pharmacy will not have the risk of taking a falsified product. Second benefit is that the pharmacist can sell the product even if the system is down offline, because there is human readable label. And the third benefit, of course, is control of authorities, physical control of the whole project, because without physical control, many of the things we have to do will be a nice wish. In fact, this is not contradicting to the directive, because verification in the pharmacy should be done, but it is not fixed when. So it could be on the dispensing, but it could be also on entering the product. So this is one thing which we would like to implement as a difference in our country, to have a little bit better control and less risks for pharmacists. This is a product produced by one of the Bulgarian manufacturers, Pharma. It is already serialized. So we have our local manufacturers progressing well with this complex project. You heard from Andreas that there are 2,500 manufacturers across Europe to do this. I will not talk about the other part of this slide, which you know much better than me. I just want to mention that at a very early stage, we decided that we'll follow GTIN as part of the 2D code, which makes the project much simpler, because we don't have all the discussions about how to work on the code. We have one specificity, that we have Cyrillic alphabet, but the figures in the code are the Arabic figures. So the Cyrillic alphabet is just for the human readable format. It doesn't change anything, doesn't make it more complex. About the constituencies, we established, as you heard very early, the local organization. We followed the constituency model of the European organization. So only the names of the organizations, which are our stakeholders, are different, but they present the same parties. So this is the pharmacist, the original and the generic industry, the wholesalers, and the parallel traders. And I think this was one of the big achievements, because following this standardized approach made much easier the acceptance of memorandum of understanding. And we had the organization established in March last year, the second one after Germany. And 2 weeks ago, we celebrated our first year anniversary. So what is the practical impact of this? Again, I will not talk this slide for the third time. I will just say that we gained time. We had 15 months for negotiations with the blueprint service providers. So on the map Andreas showed in the technical stream, we are still yellow, but we decided to take our time for a much better and longer negotiation process with the blueprint service providers, which I hope will lead us to the next slide. Let me very fast. So probably you haven't seen so many times this slide. This is the cost of the system. And the cost of the system for Bulgaria is between 2.5 million, even 2,700,000 euros per year, and 1.5 million euros per year. So that is why we wanted to have longer time for negotiations with the blueprint service provider, because of course we would like to be to the lower end of this scale, and to be more efficient for our stakeholders and for marketing authorization holders. In fact, the costs of the system are carried by the manufacturers, the marketing authorization holders, who also have the other costs of production lines, serialization of packs, changing the packs with regulatory agency. So all these costs combined with relatively small costs of the system, we need to be more and more efficient. And this is like a pyramid of the costs where you see that the European hub is relatively small part of the cost, about 5% for every country, even it could be less. The NMVO costs, this is not only the governance of the local organization, which is very slim. In fact, currently I'm the only full-time resource in Bulgaria, and we have 2 half-time consultants. Probably at the end we'll finish with 3 or 4 people maximum. But there are a lot of local costs which could be different, like training initiatives, website, different local system which are necessary, like fixing the registries. So there are some local costs which are not part of the European system. And of course the European system is the biggest part. This is the IT providers, where we'll have to pay more than 65% of the costs of the whole project. For each marketing authorization holder, the flat fee model is accepted in Bulgaria as being the best. This will be around 15,000 euros. Even if we have the savings at this level, I cannot still say, can we reduce the fee per marketing authorization holders, because the marketing authorization holders are they're optimizing their numbers of licensing and holders. So by 2019 we'll know better if what will be the exact cost per marketing authorization holder, but I hope this to be like the ceiling, the maximum one. And this is timeline of the implementation. Last year we were very much busy around the governance of the system, and this year we'll focus more on the technical part, on the building of the IT system. You heard how high are the requirements to the local organizations. We have to have an audit prior to starting the pilot phase, which for us is somewhere here in September. So very soon we need to build quality system and to have the audit and to do the system. So it is very tight, very tight timeline. And we monitor our progress on a monthly basis with the traffic lights. You can see that many things have been done, but still more to be done, and very complex, some of these yellow and red dots. So as with every project in the supply chain, I can say that we don't want to have noisy implementation. We want people not to hear about us, which means that we don't have many problems on the road. But we want to have very noisy awareness campaign at the end of 2018, when the patients, the whole population will understand why this is happening in the pharmacies. I would like to say thank you again to Mrs. Krejsa and to our colleagues from Bulgarian GS1. We work very well with them since 2012. So this collaboration is very helpful. And of course, many thanks to Andreas for the support we have from the European organization. Thank you for your attention.